All right, good evening. Welcome everyone. Thank you so much for spending your Wednesday evening with us. My name is Rich Pizzillo. I am NEHA's Executive Director, and welcome to our 12th consecutive Webinar Wednesday series. We are thrilled to have you here this evening. As we navigate the current health crisis together, our primary concern since the very beginning has been the health and wellness of you, our community. Being connected to each other is more important than ever in a virtual format. While we may be continuing to practice social distancing, staying healthy does not mean falling into an unhealthy pattern of social isolation. Our goal is to help you keep informed as possible. That's why we launched this series called Webinar Wednesday. Tonight's webinar is all about storytelling. Everyone has a good story and has heard a good story in their life. Sharing stories has a powerful ability to bring people together, to understand a different perspective, and to help find a common ground. The title of tonight's webinar is called The Good, the Bad, and the Ugly, and will feature several community members from the bleeding disorder community. Tonight's webinar is 1 hour. At the end of the webinar, we will host a Q&A format. There are no slides this evening, as storytelling doesn't need slides because it's looking at the faces of those that you may know or may not know. Our panel is from different generations of the community, different diagnoses. So some you may be able to relate to and some you may not, but there is always a joint collaborative effort when you're hearing a good story. There are a couple of quick things that we always do as a reminder in Zoom that many of you have used this platform and are experts with this now, but we just ask you to keep yourself on mute just for background noises. If you do not want to be on camera, you can take your camera feature off. In particular, the chat feature, which is a great way that if you have a question or if you want to comment, we will be monitoring the chat feature throughout. So the panel will speak, and then at the end, we will do a Q&A. So for those that this is your first time on a Webinar Wednesday, we do a live polling. So you may be saying, what is a live polling? Well, all you need is your phone. If you don't have your phone, that's okay. You could put your answer in the chat. So what I'm going to do is I'm going to share my screen. So just give me one moment here. And you will see some polls. One second. It's just taking a minute to load here. All right. All right, can you see my screen if you give me a thumbs up? All right, I see Colette's thumbs up there, so that's good. So what is your favorite campfire story song? Everyone's been by a campfire. If you've never been by a campfire, you don't have a story or song. What's your favorite book? What's your favorite movie? Anything that has a story element in it. So what you're gonna do is you're going to text 781-412-7971. And what it's gonna do is it's gonna populate a word cloud. So what's your favorite campfire story or campfire song? The Moth. All right, let's see some others. All right. We have Dancing Queen, Jack and Jill, Scary Story. Oh my gosh, who doesn't love some scary stories by a campfire? I can remember as a kid sitting by a campfire and being scared about those scary stories there. So we have ghost stories. Ghost stories are definitely coming up, a couple of different things. Ozark, it's a Netflix movie, but they do have a good storyline. So I bet you no one's involved in the cartel here, but if you are, just don't tell me and we're good to go. So great, thank you so much for sharing that. So the next one that we're gonna go to is, what is one thing keeping you motivated right now? There is no right or wrong answer for this, but what's thing keeping you motivated as a mom, as in your professional career, maybe with family? So let's see what this says here. Again, this will be kind of a word cloud. So we have running. Let's see what else we have. My kids, cooking. exercise, coworker, wine, let's see, family. This is always fun when it auto-populates here because there's multiple things going on. Niha, I love whoever said that. If it gets a little bit bigger, that means a couple of people have said that. So friends, I could read this now. All the beer, whoever said that. Exercise, Zoom with friends, and connection. Sun, yes, I can definitely agree with the sun as it's shining into my right eye right now. But these are great. So we're gonna go on to the next question here. The next question is, we always do these mental health check-ins. These are important because we want to know where you are. So I'm going to start the poll. The mental health check-in, this is anonymous. We are not tracking this, but text 1 if you're doing really great, text 2 if you're doing pretty good, text 3 if you're doing okay, I guess, text 5 if you're having a really hard time. So we'll let this go for a minute here. So we have, for those that maybe have called on the phone, 17% have said they're doing really great. 15, the majority, about half, are doing pretty good. And then we have 29% doing okay. And then there are a couple of people who are starting to struggle and having a really hard time. For those that have said this is anonymous, but we just want to reiterate that we are here for you all the time. Calling our office, the social workers at our hemophilia treatment centers are also here for you. There are child life specialists, but also the community is here for you. These platforms, while virtual, are here to make sure that we are connected and that we have that support system with us. Because as we say in New England, we are a wicked strong family, and we mean that with everything that we do. I believe that there's one more question, then we'll turn it over to our panel. So, stories. We started with a campfire song, whatever it was. Who tells the best story in your life? There's always a grandfather or, crazy Uncle John that may tell the best story, but who tells the best story in your life? My dad, Michael de Grand Prix. I'm going to agree with the Michael one. My sister-in-law, Josh, let's see, Uncle Dick, and Phil, my poppy, dad, father, Josh. So my friend Jim Duffy, awesome. So as you're listening to the stories from the bleeding disorder community tonight, I'm going to challenge you to think about maybe one thing that you can learn or one thing that you're going to hear, and then how are you going to apply this to your own life when we're talking about story. Okay, whoever has a 101-year-old great aunt who tells a good story, that's going to be our next Zoom. So Auntie, insert her name. She's going to be on our next Zoom telling the story or moderating this. I want to meet you, whoever has that. And you know what? We'll throw Uncle Howard in here too. So I'm going to stop sharing my screen, and we are going to go over to our panel. So our panel tonight has, as mentioned, a difference of different perspectives from across the community. So we're going to start by having them introduce themselves. So I'm going to have Laura unmute herself and introduce her and tell us a little bit about who you are, Laura.
Okay. I'm Laura Clinton. I'm from upstate New York, outside of the Albany area. Currently, my profession is I work at a community college, but I used to work for the Bleeding Disorders Association of Northeastern New York. So that's where some of my experience comes in. But I'm also a person with von Willebrand's disease and was not diagnosed until I was 46 years old with von Willebrand's. So had gone through a lot of things with bleeds, never knew, went to hematologist. At the time, nobody was really asking those questions about, nosebleeds or heavy periods and things like that. So eventually I was diagnosed through my son's doctor, who my son was also having, bloody noses and things like that. So eventually we were able to receive some care from the HTC. Rich had said he was going to ask us what our favorite food is. Do you want to?
Thank you for the reminder.
I'm not really sure. I'm not sure it's a food group.
What is your favorite food? Tell us.
Chocolate. Pretty much like your cheap Hershey chocolate bar is like my favorite thing to eat.
Yeah, Hershey's bars are great.
Yeah.
So dark chocolate or is this strictly milk chocolate here?
It's just strictly milk chocolate. There's nothing healthy about it. Nothing healthy about it.
I'm
But,
not a dark chocolate fan myself, so I'm going to give you a virtual high five there.
yeah.
Awesome.
So,
See, I can't.
yeah, so that's pretty much my story.
Great. All right, I'm gonna go next to who I see, and John, you're up next.
Okay, hi everybody. I'm John. I am 31 years old. I'm diagnosed with severe A hemophilia. Living with it for 31 years now. Diagnosed just before I was 1 year old. I live upstate New York. I've been living around upstate New York my whole life, Ithaca area, and then eventually made my way up to Rome, Utica area. My favorite food, I guess, would have to be barbecue. So your typical, pulled pork, ribs, things like that, along with, greens and coleslaw. This is a typical Southern comfort food. Yeah.
So the ultimate question I have for you, John, Sweet Baby Ray fan for barbecue sauce?
I do. I like dinosaur barbecue sauce is one of my favorites, which is like a local favorite around here up in near Syracuse. So.
Okay, awesome. Well, if I ever get up to Syracuse, I'm gonna have that because I'm a big barbecue fan. So thank you.
Nice, yeah.
All right. Up next is going to be Diane. So Diane, let me spotlight you, and it's all you.
All right. Hello, everyone. My name is Diane Bruno. I am fairly new to the Neha community. My son is 8 years old. We live in Methuen, Massachusetts, which is right on the New Hampshire border. It's about 25 minutes north of Boston. We didn't have any history of hemophilia in our family, so when our son was born, it was a big surprise. He's now 8 years old. We also have 2 daughters who are 5 and 3, so full house, lots to do, lots of commotion all the time, but we're doing well. I'm also a dance instructor, so I do that part-time, and I've been helping Neha with some of their programs and helping the new program director, Sarah. And my favorite food, I would have to say, is probably any Italian food: pasta, meatballs, garlic bread, all Italian.
Awesome. What's your favorite restaurant? I know not everyone's from your area, but maybe if we pass it, we can try it out.
We have a great Italian restaurant up here. It's in Salem, New Hampshire, actually. It's called the Coliseum, and it is delicious.
All right. Coliseum did not sponsor this tonight, but if you're up in that area, go check it out. Awesome. Thank you, Diane. All right, Mackenzie, you are going to be up next.
Okay. Hi, everyone. I'm Mackenzie. I am 21 years old. My brother, I'm a sibling to someone with hemophilia A severe. And when we're 15 months apart, so he's younger than I. And when he was born, we found out about that. So with his diagnosis, I was also tested, and I have a mild case myself. So I'm also a carrier, have a mild case myself, and my brother has hemophilia A severe. So I'm mostly a sibling with regard to a few things. And I'm currently a student. I'm in nursing school. I start in September, super excited. And I'm going hopefully to be a hematology nurse. That's what my goal is. And then my favorite food is pizza. And it's just cheese pizza. It's nothing fancy. A good cheese pizza. It's my favorite.
I'm going to ask you the same question, Mackenzie. You're in Connecticut. Where's your favorite place to get pizza?
Ooh. Actually, I'm not going to say we don't have any good places because New Haven has so many good pizza places. There's a place called A Modern Pizza. I've heard that it's very similar to Pepe's and almost beats Pepe's Pizza, the famous place in New Haven. So I've had it. It's pretty good.
Awesome. Thank you. So we got a favorite food here in terms of what each person loves: chocolate, barbecue, Italian, and pizza. If you're not eating right now, I see some are. I want to join you. because I have not eaten yet, but it definitely is a great way to think about what stories are. So I'm going to start by asking the panel several questions. And then I'm going to call their names out. If you have questions for the panels, we want this to be interactive. Type them in the chat. We will make sure that your questions are answered. We try to cover different perspectives of the bleeding disorder community. So please put them in the chat, and then you'll be able to unmute yourself and ask those as well. So we talked a little bit about the family element or the diagnosis. Any diagnosis in life can be a little bit challenging in terms of accepting a diagnosis. So I'm going to direct this first question over to Diane. You mentioned that you're still relatively new to the bleeding disorder community. You have 3 young, adorable children. Let's start with the family element. What should new families know right off the bat if they're new to bleeding disorders?
That's a great question. But whenever I talk to new families, I feel like the most important thing for them to know is to become connected with the community and to become connected with their HTC. So like I said, we didn't have any history of the disorder in our family. So when Alex was diagnosed at just 3 days old, we were kind of taken for a loop. We didn't know what to expect. And thank goodness, we got connected pretty quickly with Neha. We went to our first Neha walk when Alex was only a month old. So thank goodness for Neha. And so when I hear other stories about new families who don't connect with people and don't connect with Neha and they kind of feel secluded, it just breaks my heart. So I think the most important thing for new families to know is that connection is really key in feeling better, feeling like you can take control of your life again. So, and that's in regard to your HTC also. So our son at 15 months old, he ended up getting an inhibitor. So we were at our HTC all the time, like every month for our regular clinical visits. And then also whenever he had a bleeding episode, we were there and we were in the ER. And we found that the closer we became to our doctor, to everybody in the hospital, to even the staff that are there when you walk in the room, it just made us feel more comfortable. And it's funny to say that now because I'll tell you a funny story. I remember probably our second visit to our hospital, Tufts in Boston. We said, oh my gosh, I can't believe that this is going to be our life, that someday we'll know how to get to Tufts in Boston without even having to use a GPS. But then after we became happy with the staff and we knew everybody and we felt like we had somewhere to go, a safe spot, it was life-changing. It was life-changing to be able to walk in to the clinic and have the people sitting at the desk say hi to the Brunos because they all knew who we were. And so I think that connection with your HTC. And yes, I know Dr. Rosenfield is on here and she totally deserves all the respect in the world. But it honestly, it made such a difference for us being connected to our HTC, being connected to Neha. I think that's definitely one of the most important things that new families can know, and also to continue developing your own family dynamic around having a bleeding disorder. So it does change your life, but it doesn't have to change everything about your life. We still had 2 beautiful little girls after our son was born, and they're included in everything that we do, and it's a family thing now. So that would be my biggest thing to tell new families.
Great. Thank you, Diane. So I'm going to kind of piggyback on that a little bit. So when we talk about the diagnosis and new family, whether you're someone with a bleeding disorder yourself or your family, again, this is unexpected here. Thoughts and suggestions on how a parent who maybe is on here or maybe will be watching this after can help their child take more responsibilities or accept it. Everyone deals with acceptance a little bit differently. So maybe any stories that you can share from the acceptance of maybe yourself as someone who is a mother who has seen it, or even with your sibling, your other children that are there, how they have accepted?
Another great question. So I'm going to do one more shameless plug to our nurse who came to our house all the time, who was Kathy Byrne. And she taught us very early on that allowing our son to be familiar with everything that was going on around him was the most important thing. So any supplies that we were using, he got to touch. And that's tricky when you're a new parent and you have a new diagnosis to say, sure, you can play with all of these medical supplies, but these are going to be these children's whole world. So letting them see them, letting them become comfortable, that was the first thing we did to try to promote independence and let him know that all of these things were for him and they helped him and it was okay for him to touch them. And then going forward, we pretty much just took baby steps. So when he got a little bit older, we had him help mixing his factor. And then we'd have him push in his own saline and factor and explain to him what was happening. So I think taking just small baby steps as you go through life, like there's not going to be any time where you say, okay, this is what you do, just do it all now. I think just taking little pieces bit by bit as they grow up and making them available to them so that they can, do make their own understanding of what's happening around them. And it was the same. It was the same with our daughters too. And I'll tell you another funny story. And my daughter, who is now 5, every single day when we would, so our son, because he ended up getting an inhibitor, he was on daily infusions using his port every single day for at least 3 or 4 years. So we would, set up everything. It had to be sterile, and she was there, and she had to watch all of this. So once she got to the age where she could talk and tell us what she wanted to do, she decided that she wanted to play factor. So after I was done doing his infusions, she would take everything, on the other side of the table and kind of, play with it and just, wash her skin and whatever with no needles, obviously. And then once she realized that there was a needle there and she was missing this whole part of the procedure, she decided that she wanted me to stick her with said needle. And when I told her no, I could not stick her with the needle, she just broke down and started crying. And I have this amazing video that I can share with everyone at some point where she's screaming, crying because I won't stick her with a needle. So things you only see in the bleeding disorders community. But same thing, like that's part of our family dynamic, being independent both as a sibling and as the affected patient. It was all relative and all important. So take baby steps. Right now, our son actually, he just got his port removed in October. And we've been working on getting him to be independent with his own infusions. So right now, our baby steps that we're taking are for him to set everything up himself, because he knows what goes where, but he has never actually, attached the needle to the saline. So he's getting used to doing all of that. And then I guide his hand in so that he can try to infuse himself. So just baby steps, I think, is the most important thing with independence.
Fantastic answer, Diane. Thank you so much. And I see a couple of chats that I definitely agree that want to see that. So maybe that could be another Zoom here.
I will send it over. It is hilarious.
Fantastic. Well, with that said, I think a great transition is into siblings. So often, now I'm going to spotlight you, Mackenzie, since you'll be up next. So often siblings are said that they're unaffected, but they are affected. They're affected by so many different ways, and they have a voice. And Mackenzie, you have already demonstrated in your young life going into the profession that you're going into that having a bleeding disorder in your life has affected you. So can you share a little bit about how did you feel special growing up in the bleeding disorder family that you're in and in the community? And do you have any advice for parents or for other siblings about how they could continue to be connected or kind of navigate living with a chronic condition in the family dynamic?
Sure. So I also just want to like reiterate, my brother and I are only 15 months apart. I'm obviously the oldest and he's 15 months younger than me. So we grew up very in the same age group of, we were able to do the same things and everything like that. So just as like a little reminder, because I know some people, they have bigger age groups, so it's different doing things that everybody likes. But I mean, growing up, we obviously had no record or anything of hemophilia in our family. My brother's the first one. So it was definitely, I mean, I was one, so I was kind of thrown into it at a young age. So I don't know my life without it, in the best way, obviously. But you know, I grew up with, my brother has broken like every bone in his body. He's pretty much played every sport except lacrosse and football. I mean, he's even done like flag football, like in park and rec stuff. So, I mean, we used to go to the hospital all the time. I remember nurses coming to my house. And I mean, when those kind of things happen, I was just told it is what it is. Nick's hurt. He has to go to the hospital. He has to get infused. I was just taught at a young age, that's what's to be expected. And I was never alone when those things happen. So my parents obviously communicated with each other. My dad would come home and stay with me. I would go to my grandparents, which when I was little, who doesn't like to go to their grandparents' house? Like, that was so fun. And I was never alone, and I never felt like I was being traded off to somebody else. I think that was super huge growing up, because I still felt a part of the family. I never felt disconnected from anybody. And like I said, I was told it is what it is. But I know some ways that my family involved me. My brother, like I said, we had a nurse come in, so they would do infusions at home when he was younger. And I sat there and I would hold him or hold his hand, and I was always involved. I remember when he learned how to stick himself at 4 years old, he did it at NEHA camp. He was like the youngest person there doing it. I remember I learned how to, and I learned how to stick him, and I used to practice on myself, my grandfather, because he had the big veins. So I was always included when it came to stuff with his medicine. I also went to camps and Hole in the Wall, NEHA. I mean, I had friends. I was never left out. And I also want to add, like, I'm very open about it, so all my friends know. So in college, I have like college friends come here and they've seen my brother infuse. My best friends have seen my brother infuse. They know. So advocating too has also been a big thing of getting me involved. I mean, half of my thesis papers in college have been about hemophilia, just because it's interesting. I know so much. I love to read about it. I mean, the more you know, the more you can understand. And we always took that approach as a family of everybody's included, everybody's being educated. We go to meetings about new medicines, meetings about new doctors, everything we do together. So I think that's also a big thing. But also too, realizing as a sibling, jealousy is normal. I mean, even with siblings, regardless, hemophilia or not, there's going to be jealousy between them. And I've definitely had my spouts of jealousy, like, oh, you guys have to go to all the Knicks games, and oh, I have to stay at home. I can't do anything. And it's just, I've come to learn that it is what it is. Both my parents, or one parent, always has to be at Knicks games in case something happens. And I mean, as I've grown older, I've gotten over it, and now I'm just jealous over other things, like Nick doesn't empty the dishwasher and I do all the time. So just little things like that, but making sure inclusion is always just key, because I never felt left out of my family because of that link. And even doing something special. I mean, my brother, a lot of stuff has to center around my parents going to my brother's sports games and stuff like that. So I had a really big special like graduation gift that we did as a family, and that was like a really big thing for me, and I felt important and I felt special. And little trips and little things here and there. But at the end of the day, we're a family, and I do things for my brother, and I do things for my parents, and they do things for me. So it's just kind of having that open communication and love and support. That's really just the necessity of it all.
Fantastic, Mackenzie. You shared so many points of being a sibling, but also just being a person, of fitting into a family, that I think many of you that are listening can relate to in these very uncertain times that no one expected, of how to create those traditions and how to find your voice and how to know that you're never left out because you have that family dynamic. So thank you very much. So with that said, I'm gonna go over to John. John, we talked about the family dynamic. Diane set it up, and Mackenzie shared, as a sibling, you have hemophilia yourself, and you are extremely active. If you can tell me a little bit about sports. We have always heard sports, are really good for those with the bleeding disorder, but don't play football. Or, you need to be extra protected. And we've heard jokes about bubble boys or bubble girls, etc. Tell me a little bit about growing up in sports and how you have incorporated them safely into your life and what they have meant to you as you have become an adult and now a dad.
Yeah. Yeah, I forgot to mention I'm also a father of 2 little girls, and that was the main motivator in getting me back involved in the hemophilia community. Is I wanted to get that community feel and get my girls exposed to that, in case down the road they have a boy with hemophilia, or they have some kind of mild form of hemophilia that's discovered later on. So that was a big motivator for me. But yeah, much like Mackenzie's brother, I was very active as a kid. I did a lot of different sports. I did do soccer in high school, experienced a lot of different injuries, had a lot of knee bleeds, ankle bleeds, elbow bleeds, like you name it. I had a bleed probably in every joint possible. When I was a younger kid, I did have a lot of bleeds due to just being active with my father, my friends, but it never stopped me from doing the things that I wanted to do. There's definitely times where I was suggested that I didn't be so active or I didn't do these sports, but I just, at the end of the day, I really wanted to do them. So there wasn't any stopping me from doing it. So the important part for me was getting on a consistent schedule of getting my factor, making sure that the dosing was right. And that was obviously just through time and experience of learning, my body and learning when I needed to get that. And then obviously prophylaxis doesn't give you a whole lot of wiggle room to go wrong there as long as you stick with it. So that was really important in keeping my joints healthy throughout my life. None of the joints that I had bleeds in as a kid ended up being a problem joint throughout my adulthood and teen years. The only problem joint I had was a pretty major injury in high school when I had fallen when I was roughhousing around the pool. I fell and really hurt my elbow pretty bad. So that's the only joint that I have limited mobility in at this point. But I'm still very active to this day. I discovered triathlon and running and obstacle course racing in the most recent years. From 6 years ago, I just started doing that, and slowly just kept on increasing the amount of distances that I was doing, just by increasing my training day to day, and my joints have strengthened because of it. And overall, I've just kind of improved my health and tried to just keep my joints and my overall health just up there on the top of my game. But yeah, I mean, as a kid, it was really important to let me kind of do my own thing, but keeping in mind that I was certain sports are more riskier than others, like football and lacrosse. And unfortunately, I did learn the hard way with lacrosse and ended up getting a pretty bad bleed with that sport as well. But at the end of the day, they're going to be able to stop children from wanting to play and do their own thing. They need to learn their own bodies. They need to learn, their limitations. And, that's the best way to do that is through their own personal experiences. And that's definitely how I got to where I am today. So, and I was supposed to do my first Ironman next month, but unfortunately that was postponed due to everything going on. So it's going to look like it's going to be next year. But in the meantime, I'm going to be doing a few half Ironmans just around the lake, near my house and everything. So not an official Ironman, but just go do it for fun kind of thing. So if anybody that doesn't know what an Ironman or half Ironman is, it's 140.6 miles of swimming, biking, and running. So it's a good achievement, especially for somebody in a bleeding disorder. Yeah, so.
I think you have the quote of the evening. I'm just going to do a half Ironman for fun. That is something that I think many of us applaud you on for having a bleeding disorder and taking this on. But I want to ask you another question, because I think many that are on prophylaxis, whether it's a infusion or an injection, all the treatment right now, at least for hemophilia, is any type of an infusion or injection. Staying adherent, so adherence means that what your physician prescribes is you're following it every day, once a week, on demand. Can you speak a little bit about how you have had to stay adherent to make sure that you're mitigating the risks of bleeding being so active?
Yeah, so I definitely follow the doctor's recommendation to a T, but it's definitely important to keep that communication open and communicate how you're feeling, how your body's feeling, because nobody knows, what you're feeling except for yourself. And the doctor may know what is supposed to work in your body, but you need to communicate that, I think this is too low, or I think that I need to go on a different medication. I've had to do that on numerous occasions, and definitely more recently in my life, I've been, changing different medications just because I think that they're going to be, better, and some are better, some are not as effective, I've learned. So keeping that communication open and being persistent and being an advocate for yourself is definitely going to be very important. And obviously for like the younger families with children, making sure that they're learning their bodies and learning how to recognize a bleed when it's occurring, or document those bleeds, keeping a nice journal, things like that kind of help them build that awareness of what they should be feeling and how they should be feeling, because it's very, very achievable for somebody like me to go out and do an Ironman because I'm on a good consistent regimen of consistent factor. So yeah, there's no reason why anybody with hemophilia can't do anything. So
fantastic. You mentioned a couple of key words I wrote down here of communication, adherence, and making sure you have a good relationship with your provider. Those are really key, because if you're not discussing what's happening in bleeds or logging, I know it's a pain to log, but it's crucial. Data really helps to determine if there's a joint issue or a muscle issue. So those things are really key. So I appreciate you sharing that. There's a couple questions in the chat, but I'm going to wait to ask those until we move on. So there's some questions there. So I'm going to spotlight, last but certainly not least here, we have Miss Laura. Laura, we talked about the unaffected sibling, and Mackenzie did a great job, but von Willebrand's often is confused with hemophilia. So many that live with VWD often say, I don't have hemophilia. I don't want to sit through another hemophilia conference. I have VWD and it's complicated. Can you share a little bit first about VWD and what it's been like to have it in your family?
Sure. So one of the things about VWD is it's not carried on the the sex-linked gene. So it can be, you don't have to be a man, you don't have to be a woman. I mean, anybody can get VWD. And I mean, it usually I always just kind of draw a line down my body. That's kind of like the big bleeding points are your teeth, your nose, stomach for women, heavy periods, things like that. And there's different levels. I'm von Willebrand's. I have mild von Willebrand's. For the most part, like I said, I was 46 years old when I was diagnosed. There were some things in my life that hindsight, I could check off the list when the doctor was asking me, do you have bloody, did you have bloody noses? Did you have any problems with your teeth? Did you, I was like, yep. So, as far as sports and things like that, my sons were diagnosed first. And I mean, with the proper medication, both of them played sports. And, they treated on a bleed. So there's no for our von Willebrand's, we didn't treat prophylactically. We treated, per bleed. So, I mean, I'm not sure if you want any more information about von Willebrand's, but
No, I think that's great, Laura. That there's a difference in that. What you just mentioned is it's still a bleeding disorder, but there are unique characteristics within VW.
Right. So we won't. I mean, and again, it depends on the type and the level. There's different types. It's a complicated bleeding disorder, and even complicated to diagnose. So there's different levels in each type of von Willebrand's, and some people who with von Willebrand's do treat prophylactically. They do have to, they have no factor. There are no von Willebrand's. So but we were very lucky in our family to have it mild. We were lucky that we were eventually diagnosed, and I get it. We're talking earlier. One of my stories is walking into, well, first it was the pediatrician's office. I walked in with my son. He was having a lot of bloody noses, and I thought maybe he had allergies, because that's what I was told when I was younger. I have allergies, so it's no big deal. And his pediatrician started asking me questions and asking what my history was, and he pretty much said, you need to go to the HTC. You both need to be tested. I would test your whole family, and two of my children tested positive, and I did as well. But when I came home and looked up online, of course, you Google von Willebrand's. I didn't know anything about it before my doctor's visit. So I Googled von Willebrand's, and most of the information that came up was about canine von Willebrand's. So apparently dogs have von Willebrand's, and for a long time, that was the first thing that would come up on a Google search. I think a lot of that has changed over the past 10 years. That's when we were diagnosed 10 years ago. Now you look up von Willebrand's and Google search, they push things up. So the search does come up, for human von Willebrand's. But, our first HTC visit, we sat there, we got a folder that was probably this thick, I brought it home, and I was just, I didn't even know where to look or what to do. We did not have, we had a chapter here. We had the Bleeding Disorders Association here, but at the time they didn't have anybody who was working there. So it was all volunteer. And I honestly the HTC hadn't really mentioned it. There was a little piece of paper in there. And I happened to be looking for a job at that point, and there was a job for the Bleeding Disorders Association. So I was diagnosed and, got a job in the bleeding disorder world within about 2 months of each other. And then, became very entrenched in bleeding disorders. So then I knew more about it. But, honestly, when we first started this journey 10 years ago, I knew nothing about it. I knew nothing about a bleeding disorder. I knew very little about hemophilia. I knew, I learned as I went along. And I think, a lot of the new families may have this same feeling that I had when I started. It's like, who do you turn to who do you ask for help? What groups do you go to? And NEHA, you know, you're a great group. I mean, you have a lot of information, you have a lot of activities, and I think, you know, just going to these events and going, you know, participating and getting involved and meeting people and, you know, sharing your story, listening to the other stories, you know, everybody on the panel so far has, you know, spoken about something has affected them. And I believe if you ask your group that's listening, someone else has been affected in the same way. You know, we've all either feel like we haven't known enough about our disorder, we have siblings with, you know, a bleeding disorder, children. So, you know, like I think it's very important to get involved in the community. Talking to your HTC, that was key for us. We were lucky to have a great pediatric HTC. Our area does not have an adult HTC, so that's a different story. But a lot of the information I received, I could call up the HTC and just say, I don't even know what I'm supposed to be doing, you know, with the activities, with the sports for my boys. You know, what type of thing should I be doing? You know, so they, you know, and I think most HTCs, and the physician on this would also probably have a letter that says, that goes to the school. This is what this child needs from this in the school setting. Just educate yourself and learn more about what it is. Listen to your body. You know, Jonathan was talking about that. Listen to your body. A lot of us, I will also say, Jonathan, you made me think of this. You know, a lot of times anybody with a bleeding, sometimes when you don't have a bleeding disorder, you will get sore muscles. So sometimes those sore muscles are just because they're sore, but always be aware of bleeds, or, you know, and if you're questioning it, if it's sore for a long time, if it's just doesn't feel right, call the HTC, and always, you know, feel comfortable in doing that. They're there for you. The NEHA is there for you as well. I mean, I know there was a question that I think ties into this, Colette and George. You asked if we ever get tired, if anybody gets tired of, you know, going to NEHA and to HTCs, and I just want to say that, you know, sometimes it can be draining to, you know, especially, you know, Diane, you were talking about an inhibitor, you know, to always have to go to the HTC, or, you know, NEHA does a lot of events, you know, going to all the events all the time. But you know, like, they're there for you to help. And I feel like that, that tiredness comes from the actual bleeding disorder, and not so much the events or the visit to the HTC. Sometimes it's just a struggle to constantly live with a bleeding disorder, and, you know, finding that support through the community and through the HTC is really important. You don't have to go to all of the events at NEHA, but, you know, they're always there when you come back to it. You know, you can always come back to an event. You can take a month off and then come back, or, you know, take 6 months off from NEHA. Always make your HTC visits. But, you know, Rich and his group are going to be there, and, you know, just, you know, keep in touch.
And that was a perfect kind of segue, and you answered this of coping. And I'm glad you asked that, George and Colette, there, because I do think that advocacy organizations like NEHA and many other are there when you need them. This organization has been around for 64 years. And there have been multiple people that have come through. But when we talk about coping and accepting and communicating and educating, these are all things that being involved is not for everyone. I mean, there are plenty of individuals that are in the community that have never been to an event before because they don't know what to expect. But I think that that was a great segue into the coping of accepting of, you know, so you have all this information now, you have a family and you're dealing it with yourself. How do you accept some of this? So going to go on to a couple of other questions here. Thank you, Laura. Great job with that. So John, I'm going to spotlight you because I'm going to go down the list here. And George had said, my mom and dad never stopped me from doing what I wanted either. My friends were put in the pitcher spot when I was batting, and my friends ran for me. This is before Factor was available, pre-1978, which I think is a great explanation of what life was like, when Clotting Factor first came versus where we are now. But the question that is here is from a mom, and it is, what advice would you give to a mother raising two boys with severe hemophilia? What did your parents do to support you that you think of fondly, or that you wish a parent had done to help you?
Oh, that's great. Great question. My mom, I think, is watching in, so I got to be careful what I say. But no, I'm just kidding. But my mom was, of course, a great support to me. Definitely thankful for how closely that she was, watching over the things that I did. But at the same time, it was frustrating for me as well, how closely and how restricted sometimes I felt fighting with a doctor and my mom, or my dad was kind of more on the loose end and said let him do anything. So that's obviously the direction I wanted to go. But I'm definitely thankful for she and my doctor obviously didn't let me play football. It's one thing I really wanted to do right up into high school, high teens. I wanted to play football, with everything I had. But with all the research and everything, all the head injuries and joint injuries that people come out of football with, I'm super grateful that that never happened later on in my life. So as far as a physical standpoint, I think my parents did a great job and giving me a good balance of letting me do what I wanted to do, but making sure I was still getting my factor on a consistent basis, and monitoring my bleeds, icing in those areas that I had injured, resting, compression, the Rice method. And then also, one piece that I would have to say that we weren't, so yeah, going back to when I was born, before I was born, obviously the treatment wasn't as great. There's a lot of things going on with, the whole AIDS breakout and the Hep C, I think it was, and everything that was happening then. Definitely thankful for the time period I was born in. So that helped a lot with, making myself able to do more. But also, as we've kind of evolved in the hemophilia community, more of like the mental side of things is something that's kind of been unlooked, I think, in like my generation and generation maybe a little bit before me too. Like the mental health side of things, as far as it can take a good toll on somebody just constantly being told you can't do this because you're this way, or you're not able to because you have a bleeding disorder. So that definitely played a role in, I guess, motivating me to do more on the positive side of things, but it also played a role in just kind of making me feel not, I guess, adequate enough, and making me feel like I was less of a person because I had this bleeding disorder. So I think now mental health is definitely on the rise, and definitely should be something that's looked more into, especially with the little kids. They don't understand, why they can't go do this sometimes, or they don't understand why they're different, because it's not something that they see. It's something that's inside of you. So
That was well said, John. I think you just really, struck a nerve with me in terms of the mental health aspect. It's certainly something that I think for anyone living with a chronic condition to keep in mind, that it's okay not to be okay sometimes. That there's a lot of weight that you're carrying in this kind of realm here. So thank you so much for giving a very thoughtful answer to that question. The next one is Mackenzie. You're back on the spotlight, my friend. So the question comes, curious about the dynamic of supportive siblings and the extended family. I have two boys with hemophilia, so there is no dynamic of a sibling that doesn't have a bleeding disorder, but it's my passion to increase awareness among family members who know nothing about what our life is like. My boys are first in our family. Any advice as a sibling of ways to educate and raise awareness in the extended family? Excellent question.
All right. So I know like we our extended family, we also can, like, my mom's best friends with her friends from high school, and they're all, us kids are the exact same age, so we are like more like cousins and friends. And I know growing up, like, obviously my mom probably took more of a role explaining to her friends and family like the gist of things, but I know with my friends and with the kids I was growing up with, we kind of just explained, you know, it's important that if Nick gets hurt, you need to check on him. You need to make sure he's okay. He feels okay. Tell my mom. I mean, I always knew also too, like if Nick got hurt, to tell my mom, or if he was bleeding, or he was also taught to be kind of an advocate for himself also, like speak up if something feels wrong. But like I know Nick's friends, they know that he has hemophilia, and he's told them, you know, I have a bleeding disorder, my blood doesn't clot properly, I have to take medicine if something bad happens. So he used to go on bike rides down the street with one of his friends. They knew if something were to happen to call my mom, and they had a gist of an understanding. I don't know how old or young your kids are, but even just giving them a basic understanding of family, friends, and stuff, that, you know, it's a serious thing, but it's not the end of the world. It's not a debilitating bleeding disorder. You can still do things. It's just big to be proactive. I hope that answers your question, but that's what I got.
Yeah, no, that is great. I mean, there's a quote that says, speak only when necessary. Your actions kind of help to educate. So I think that there's a way of acceptance that not everyone is ready to tell their family or school, but there is a way of showcasing that this is real and that it affects you. And, you know, we've heard everything from different elements of, hey, there's Nick.
We got Nick involved. He just
Look
came
at that.
home.
Look at that. Hey, welcome, Nick.
Thank you.
Yeah, you know, Nick, since you're on here, we can ask you to put you on the spot. As someone living with hemophilia yourself, how would you educate your friends, say in college? You know, how do you talk about hemophilia?
So I've always explained it as the domino effect, because that's how my mom first explained it to me, and that's how we kind of learned. So I tell them that there's 10 dominoes. I'm missing that 8th domino. So when 7 falls, it never hits 9. And that's the easiest way that I would say to explain it to people.
Great.
And that then I take my medicine, and that creates the 8th domino, so then my blood will clot.
Yeah, and not to put you on the spot here, but I kind of am. Little did you know that by popping into the video, you would be asked questions here. But and it's okay. There's no right or wrong answer, because I think everyone will answer this a little bit differently. But are you ever ashamed to talk about, you know, having a bleeding disorder to your friends, or do you just kind of openly talk about it?
No, I'm not. I'm definitely not ashamed. It's not like, if you're my close friend, I would tell you, but it's not like something that I wouldn't just come out flat out and say, oh, I have a bleeding disorder. You know what I mean?
Absolutely. But close friends, you're okay sharing it with them.
Yeah, of course.
Yeah. I'll just share a really quick story here that, you know, wear your medical ID. I was in a grocery store once, and the person behind me was looking at my medical ID, and I couldn't really tell what they were doing. And I realized they were being nosy. They were trying to read what was on my bracelet. So finally I took it in with myself and took some courage. I just kind of turned around and just said, hey, I can see you're looking at it. I have hemophilia, and let me tell you about it. It ended up being a great conversation. I know that's not going to be for everyone, but I do think that it's just a great way to maybe think about, you know, advocacy there. So speaking of advocacy, Laura, you're back up on the spot here. The question that came in is there anything we can do better to support you and other VWD patients in our community?
You know, it's interesting because Neha has a large population of hemophilia where, the Bleeding Disorders Association, it was 90% von Willebrand's. So, I think listening, supporting, those are ways that you can help. And, I've been to some chats, which, not here, but, like I've been to some, women's chats or group chats where all of a sudden you're trying to one up, well, oh, you only have von Willebrand's, you don't have hemophilia like we do. And I think to avoid, avoiding that would be, the biggest help for anybody with von Willebrand's, because no matter what your bleeding disorder, it affects you. It affects your life. It affects your family. I have a lot of embarrassing moments because of my von Willebrand's that, I won't go into online, but, I just think that's the best way for support, just listening to someone with von Willebrand's and understanding that, it affects us as, as much as your bleeding disorder affects you or someone in your family.
Great. Thank you, Laura. Diane, a message came in privately that that was directed at you. So the question is, as a mom of 3 kids who are young, our past is dark. Our past talks about those that contracted HIV, AIDS, hepatitis C, as John mentioned, and we lost many community members. How do you, as a mother, help to educate about the past? And it may be too young for your kids, but just as a mother, any thoughts around how you will keep the history of the bleeding disorder community alive for your children who thankfully have a clean product?
Awesome question. So I would say the first thing would be to educate yourself on that background, because we didn't have any history, like I said. So even finding out about that for me and my husband was a whirlwind. So educate yourself on that background before you try to talk to your kids whatsoever. We've been to a few national symposiums, and they had a great museum room that we were able to bring our son in and walk through, and that was a great resource. So he was able to look and see, where hemophilia came from, and I'm pretty sure HFA has all those resources on their website as well. So it's cool, and especially right now where we're all doing online work with our children anyway. So it's probably a good time to go through, if you're bored and need something to do, to check out HFA's website and just have them take a look at all of those things that happened in the past. And when it comes to some of the darker stuff, like the AIDS and the HIV that happened in the 80s, I have spoken to my son about it. I think the most important thing is to explain how things have changed along with the information that happened in the past. So, you never want to have your child be fearful of something that they need in their life. So I think just giving them the information and then turning it around and explaining where we are today and how things have changed and how they don't have to worry about it as much, but to always be aware and make sure that they're, advocating for themselves and in everything that they're doing.
Rich, can I piggyback on that?
Yeah, please do.
One of the things with, that makes it current is COVID. And there's a lot of products that they're working on that have to do with plasma. And tying it back to what this community went through back when, there was dirty blood and, and people were dying of AIDS and, they were getting Hep C and things like that. It really makes it current. So, that is something that our community can be very proud of, that, this is the reason that we're able to use plasma for some of these, COVID, hopefully cures or, viral medicines, is because the plasma that it goes through such a stringent process now compared to what it was back in the day.
And it's such a great perspective that you both shared. John and Mackenzie, I think it's such a great question. Would you guys like to add anything about how you as a sibling or you as someone living with hemophilia are kind of making sure that the history is not being forgotten? Either one of you can take a stab at it here.
I mean, for me, I have a few friends that have been affected by Hep C in the community. So I like to keep educated, like to keep informed on, what pharmaceutical companies are doing to, make it better or make it safer. Obviously educating, myself on what current medications are, I guess, safe to use and what they're doing to, I guess, make them safer, and the research that they're doing, making sure that obviously that is going in a safe direction as well. So I'm definitely involved with, making sure that at least, for myself and hopefully I can try to make an impact for other people, making sure that, Factor continues to be safe along with the up and coming, gene therapy and things like that. So.
Fantastic. Mackenzie?
And kind of going, kind of like what Diane said, I mean, having the education, but also not making it a scary thing. I definitely learned more information through school, and just educating myself as I got older, because I was able to read more about those things. I'm a very like visual person, so reading to me is something better than being like told. But I mean, when I was like the history of it and being told as a child, those kind of things, it was just more like history and then like safety. And it's like, this is why we don't reuse needles, or this is why we don't share needles. We put them in the sharp box, and just making it less of a scary thing in the whole education piece. So pretty much everything Diane said in a pretty little bit.
Great. Thank you, guys. It's past 8 o'clock, but I think, that question, thank you for the individual who asked it. It's a powerful question, and I think it's part of our history. It is such an exciting time to have a bleeding disorder in 2020. Products are safe, and I think George summarized it really nicely in the chat. Learn from the past, but the future is bright. We have an amazing community here in New England. Many of you which participate in it make up this community. So I encourage you to continue to have a voice, to continue to be involved, to continue to stay active, and to continue to know that you help to make this what this is. So with that said, I want to thank a big round of applause for Laura, for John, for Diane, and for Mackenzie for spending and being vulnerable and sharing their stories. I was hungry before, but after listening to you guys, I'm not hungry anymore, because you guys have filled me up tonight with your stories and the way that you have expressed yourself. And for those that are on here, hopefully you can take something away from one of these perspectives, that everyone does have a story and that your story is unique and your story is special. So when appropriate, share those stories with extended family, whether it's forming a walk team or whether it is attending certain events. All these things are really important to stay active. I am going to put a plug, and you'll see an email coming out about this, to something that John said. For those that knew, NEHA started, it would be 5 years ago, our Consumer Medical Symposium, which is all based upon the current treatments and the potential treatments. That program was scheduled for August 22nd. It is going to go virtual. So when it happens, I really encourage you, when you see the email, come to it. It's a way to ask questions. It's a way to be involved. And it's a way to really navigate what does all this mean here. So with that said, I hope you enjoyed yourself this evening. I will put a plug that there are a multitude of events. Laura mentioned of the events that are happening on our website. If you go to www.anyhemophilia.org, you can see a Blood Brotherhood chat, which is currently happening every other week on Thursday at 8 p.m. There is one tomorrow night at 8 p.m. If you've never been on one, it's a great a great chat for men living with the bleeding disorder. There's a women's chat Tuesdays at 9 o'clock coming up next week. There is a dad's chat this Sunday. Eventually, there is going to be a scheduled new family chat. There are fitness classes on Sundays that many of you have been on that have beginners, intermediate, and then advanced. That's led by a physical therapist who has hemophilia. And then the educational events. Family camp registration ends this Friday. So some have asked, can I come to family camp? I'm a family. Everyone's invited to come. You can come. It's going to be a great virtual experience, and then you'll see more of the events coming up. Next week is our next webinar at 7 o'clock of mindfulness, and that will be brought to us by in partnership with Takeda. So you'll be seeing a email about that will be coming out. I'm also going to put it in the chat. So if you're interested about it, it's going to be a great interactive workshop that you can attend. I just put the link in the chat. There you go. So you can register right now if you're looking for something next Wednesday. But again, thank you. Have a great night. Thank you to our panel. Thank you for all of you for believing in Neha, and we will see you again soon. Take care. Good night.
Good night. Thank you.